the impact on health. And when I say health, health is not just human health, but health for human, animals, and planet itself, the plants as well. So whole ecosystem is actually getting it suffer from sustainability issues. So we all are talking about sustainability, and accreditation is not different than that. So we took this theme up from Global AXI and thought of weaving around some of the important topics, inviting some of the people who can talk about different topics. And there are two agendas primarily divided. One is the launch of a very new product which we have developed for medical value tourism facilitators, which is a key for driving medical tourism not only in India but globally. And we have the best institution in healthcare. They are accredited as well, but we want to bring more and more a player into it and also create an environment for those who seeks medical services in India coming from abroad through facilitators, which are very, what do you call it, credible in providing their services. So that's one. We will be launching this, and we are very happy to have a couple of dignitaries like Jayant Pujari Saab, Rajiv Singhal, Dr. Guru, Mr. Jory, and Vandana, who will be launching as chief guest and guest of honor. But before going there, I would request my colleague Chandni to play the video, which has actually will showcase what QI is doing in last 7 years and has done something specific to healthcare. Chandni, may I request you to please play the video? Thank you. Thank you, Chandi. Thank you very much for putting this up, and thank you all my team members for putting this beautiful video together. Glimpses of some of the activities which we have been doing. So thank you so much. Before we proceed, I would like to really welcome all the participants, delegates, and most importantly, all the people who have joined today, including our chief guest, Vaidya Jayant Pujari Sahab, our guest of honors, Dr. Rajiv Singhal, Dr. Guru Narayan Reddy, Mr. Anil Johri, Dr. Vandana Siroha, and eminent speakers. Dr. Tina Janaimian joining from Australia. Thank you, Tina, for joining this. Dr. Chitesh, I will be introducing them in detail when their turns comes up. Professor Nadra Chaturvedi, Professor Bijan Mishra, and Elaine O'Connor. So thank you each one of you for joining this event and making it a success and celebrations of World Accreditation Day. Now we move on to our next agenda item, which is launch of a QAI accreditation program for MBTF. Uh, for those who may not be aware of, MBTF means Medical Value Travel Facilitators. So these are the agencies who actually helps uh, people, patients, bringing patients from abroad to India or other way around. It's not just India, but it's a cross border travel of patients seeking medical services, as well as taking the opportunity to move around, enjoying their culture and heritage of different countries. And so this is very important in terms of giving genuineness and confidence to patients who are traveling from abroad to different countries. And so this initiative was started with the Department of Commerce long back, but nothing shaped through international. But thanks to Ministry of Ayush, who have very much interested to driving Ayush system for medical tourism and set up a task force, a technical committee headed chaired by Mr. Anil Johri to develop a system for recognizing those medical value travel facilitators, in particularly Ayush, but our program will be relevant for everyone to work on a quality mark called Ayush quality mark. So Ayush quality mark is for some services, including MBTF, healthcare services, testing services, as well as product, which comes under Ayush product division, and they can be applied for Ayush quality mark. With that theme keeping in mind, we developed a QAI 22525 plus program for MBTF. There is ISO standard ISO 22525 and equivalent Indian standard. So we based out that standard and developing QAI 22525 plus for MBTF, which will be recognized in the Ayush quality mark for that recognition, as well as international recognition, because this is based on international standard. So this is the moment for launching this new program under QAI healthcare vertical. And with this, we have actually requested Vaidya Jain Dev Pujari Saab, who is a well-known, Ayurveda Acharya and policy maker in Ayush system for many years, and he headed National Commission for Indian System of Medicine (SCISM), which is the apex body for Ayush regulation. So thank you, sir. Thank you very much for accepting our request to join as chief guest for launch of this program. Along with him, we have Dr. Rajiv Singhal, who is QI board member and also founding member, managing director, and group CEO of Marengo Asia Hospitals. And also he chaired the FICI MBTF committee. Welcome, Dr. Rajiv. We also have our guest of honor, Dr. Guru and Reddy, a well-renowned gastroenterologist, practiced in US for several years, and then returned to India to set up Continental Hospitals, and now is a chain of hospital based in Hyderabad. So he is the founder, chairman, and managing director of Continental Hospitals. We have Mr. Anil Johri, chairman of the technical committee for Ayush Quality Mark Scheme. I have the privilege of working on this committee with him. But he also he is a former CEO of NABCB in Quality Council of India, is an expert of conformity assessment bodies, accreditation program, and has been very instrumental in helping and supporting organization in government for creating policies and developing new programs and schemes. So welcome, sir. We also have Dr. Vandana Siroha. She is an old colleague at NABH. Currently, she is the director of Rashtriya Ayurved Vidyapeeth in Ministry Ayush, and she is also looking after as the director of Ayurveda Training Accreditation Board at TAB, which again I have been privileged to be part of it along with Mr. Johari. So with this, may I request Ved Jain Jay Pujari, our chief guest, to please announce the launch of this program and say a few words. Over to you, sir. Thank you.
Thank you very much for calling me over here, and it is really a great opportunity for me to see such a dignitaries in this field of accreditation and standards. And first of all, happy Accreditation Day to all, because all are working in the same field. And the most important thing, QA developed standard that is also based on ISO standard regarding medical value travel facilitator, because this is a need of the hour, because many agencies are operational all over India, and particularly I know in the field of Ayush, now Government of India has launched Ayush Visa. So there is a portal from Ministry operational for this purpose. But at the same time, as we are aware, many people, many institutes, many organizations, many persons individually, they are operating in this field. And to create a standard for this purpose is really a great thing. And I repeat, it is need of the hour. And this great work was done by Dr. B.K. Rana's team from QAI. And now I declare the launch of this medical value travel facilitator accreditation standards.
Thank you so much. Thank you very much for the honor. Now I would request Dr. Rajiv Singhal also to say a few words. Over to you, Dr. Rajiv.
Thank you, Dr. Hello. Is the voice echoing?
Yeah, there is some echo actually.
Let me rejoin.
Yeah, you can join. Then I request Dr. Guru and Reddy, who has already joined, to say a few words. Over to you, Dr. Guru. You're muted, Dr. Guru.
Am I audible now?
Yes, you are audible now.
All right. I was just saying, distinguished chief guests, Mr. Singhal, the other doyens of India's healthcare and all your contributions, and particularly to Dr. B.K. Rana. The man is untiring. His efforts of standardizing various protocols and believing in accreditation and trying to push on various fronts is truly laudable. Okay. And this is truly the need of the hour in terms of the medical value, the travel facilitator that you have initiated, because India, although is not in the top 5 or 6 or 7 or 8 as a medical travel destination, somewhere around 10th or 11th and whatnot, but still the belief amongst Indian doctors in terms of their capabilities, the skill sets, the hospitals, the infrastructure, and all of that stuff, the travel convenience, and the cost of care at the end of the day. is the biggest attraction to many of the countries who are seeking care here. And so it is extremely important, I guess, how these patients are choosing the facilities and what are the criteria at the end of the day. Do the current existing accreditations, whether it's NABH or Joint Commission, et cetera, will suffice? Or one should look at from a standpoint of some diversity here encompassing the needs of these international patients. The biggest need that I always find is the cultural diversity, which encompasses in terms of their communication, in terms of their language, in terms of their spiritual beliefs, in terms of their culinary habits. And all of these things become extremely important that we often pay not much attention. So when we are talking about safety accreditation, I think safety should also encompass many of these aspects, which often are not, a part of the curriculum or part of the evaluation standards of currently existing, accreditation facilities. And the other aspect of safety, and I'll wind down, is that what happens, we all know that all these agencies, the middlemen, the facilitators that exist in the country, where they are facilitating these patients who are often innocent, who are coming for true and valuable care, facilitating or where their commissions are well preserved, irrespective of the various standards that are required in terms of the safe care and practicing highest of quality and all the standards which are required. So I think it's high time to some sort of a distinguished accreditation that can differentiate, and this can have some impact on these international travelers from a slightly different perspective. And if hospitals are assessed on that front, I strongly believe that it'll be a worthy effort and something we should all look forward to. Yeah.
Thank you very much, Dr. Gu. Thank you so much for your words of wisdom. Dr. Rajiv?
Yes, thank you, Dr. Anand. Dr. Reddy, it's a pleasure getting connected with you and rest of all the colleagues here. So great. Few points on this. I think one, Dr. Anand sir, I think you have been doing a great job in pushing the quality beyond borders. I think that's one thing which is important because that is a concern which everybody has. How India is seen as a quality healthcare. As Dr. Reddy also mentioned, that a lot of trust lies on the Indian doctors all across the globe. It's not only in India, but outside also people have a lot of faith and trust as far as the clinical outcomes are concerned. One thing which is missing, and I would just take a reference of the unfortunate incident which took place in Delhi a few days back, where some patients have to lose their life because of the kind of place where they were put in. It's a matter of, I consider this as a cause of national concern or a national pride. We cannot be seen by the external world as people who do not value quality, and we do not value lives of people. And when people trust to come to India, it means that we are responsible for their well-being, safety, security, quality, right moment they land at the airport and when they depart from the airport. I don't know whether this will come into the I would say within the scope of finding out where these people are basically being kept. Can this be part of quality? The point is that somewhere I think we all operators, are we in trying to make quick buck, or are we trying to look for a system overall which may take certain amount of time? Business may dip for a certain period of time, but if we all pledge that yes, we are happy to take that dip and people have to go through a process, I think India will emerge as top destination, because once we assure people, I think it's the assurance which is lacking, and we should have the complete coverage of quality of people who are trusting us. I think it's a very, very big field to play. a small amount of dip in the business should be acceptable to all, but we should not compromise on quality. And we are wholeheartedly supporting you, Dr. Rana. You take it to the level. I think all of us who are here are more than willing to support you to cover what is required to bring national pride back on this. Thank you.
Thank you, Rajiv. Thank you so much for your word of encouragement. It really helped us in moving forward. Thank you. Jody, sir, some words from you. You're muted.
Yeah, sorry. Yes. Good afternoon, everybody, from Germany, where I'm sitting right now. Thanks, Dr. Rana, for inviting me to this event. I have a special interest in this because, as you've already mentioned, I was nominated to chair a working group last year by the Ministry of Ayush to identify products and services which meet global standards and which could be conferred a special mark of recognition by the Government of India, which is now, Ayush Quality Mark launched by the Prime Minister on 19th of December 2025. And this system is parked in, for the time being, in Ayush Export Promotion Council. During the deliberations, and Dr. Rana is well aware because although he was not a formal member of the working group, but I invited him to be a part of the working group, and he was great help to us in our in the deliberations. We found to us, much to my surprise, because I am not a healthcare, I am not in healthcare domain, really speaking, that there was a gap in terms of medical value travel facilitators as well as wellness centers. There were no certifications or accreditations, and no standards had been laid down, except that we found in ISO there was standard. There was standard for what they called wellness spa. There was standard for what they called a medical spa, and there were standards, of course, for medical value travel facilitators. So we decided in the working group that okay, let's adopt these standards. This is especially relevant because I think sometimes people are missing a connection that India Ministry of Ayush through BIS has actually succeeded in creating a subcommittee on Ayurveda and Yoga in ISO. So India has decided as a country that's going to leverage ISO standards in Ayush sector to internationalize Ayush. And therefore, ISO standards become even more relevant. And in this case, we laid down a criteria for MVTF. And I was waiting that somebody should start a program on MVTF, which is as per a global standard, which Dr. Rana has done very cleverly. I know he has done ISO 7101 plus, and he has done it for now ISO 22525. Which is a way to go actually. One of the ways in which we can internationalize the standards is to pick up a generic ISO standard, customize it to Ayush, and present it to ISO to publish the separate standard for Ayush sector based on the, like ISO 9001 has been repeated many times in various sectors, in aerospace, in telecom, in automotive industry. 9001 has been customized, and then it has become a full-fledged international standard. So congratulations, Dr. Rana, for coming out with this. Another issue, point that I should make, because somehow we forget that this is voluntary space. This is not a regulated sector. There are no law. If there was a regulation, there would be a single regulator. But in voluntary space, you face competition. And Dr. Rana understands very well because he's in competition in healthcare accreditation. And there will be competition here also, I'm sure, in course of time, if not today. So, but that's good for industry in certain ways. More efficiency, less cost reduction takes place. We have seen examples of more efficiency and less cost. So all the best to you, Dr. Rana, on the launch of this program. And hopefully somebody will come up, and I will at least continue to be chairing the Ministry of Ayush, committee for grant of Ayush Quality Mark. So I hope to see some organizations with QA accreditation coming up to seek Ayush Quality Mark. All the best to you. Thank you very much.
Thank you so much, sir. Thank you very, very much. We are hoping that you would get that soon, maybe next 1 month or so. We'll get first quality mark. through the QI accreditation. Hope so. So thank you so much. So I think now we come to a very, very important occasion of the time is to launch. And may I kindly request our chief guest, Dev Pujari sir, to please announce, and we can play a video for launch.
Yes, sure.
Chandni, you please play the video. Thank you. Thank you, Chandni. Thank you very much for the video. Thank you. Thank you, Dev Pujari sir. Thank you so much. Thank you everyone for joining on this occasion. We are privileged to have you all here. And you may stay. We will have the next session where there are eminent speakers on different topic talking about. So moving on to the next agenda item, I have the pleasure of inviting Dr. Vandana Siroha, who is our guest of honor as well for the launch of MBTA program. She is the director of RAB and Ayurveda Training Accreditation Board at the Ministry of Ayush, and she will be talking on accreditation of Ayurveda training courses. So over to you, Dr. Vandana. Thank you.
Namaskar. Thank you very much, Dr. Nikita. And first of all, let me congratulate you all on Accreditation Day. Every year, World Accreditation Day provides an opportunity to recognize the vital role accreditation plays in supporting the confidence in products and services and organization around the world, as Mr. Joy has just spoken about. And I must acknowledge the previous speakers, they were giving more emphasis and what accreditation actually means. And this time, the theme is innovation, trust, sustainability, which are the power accreditation. It's a very new program. I must congratulate the team QOL for launching this beautiful standard. And this is a need, as Pujari sir has just told, that in medical value travel facilitators, we have recently launched in our ministry, which is Ayush Visa. That scheme is also requiring this particular standard, because whenever we create new horizons in our pathways, in our systems, we also acknowledge few difficulties. There are few loopholes as well. But whenever we standardize and we focus on our approaches, these give more clarity how to work, what to work, and what to do next. So as India is becoming leader in traditional medicines also, we have our GCTM, which is a global center for traditional medicine. WHO's this center is also there in Jamnagar. Our Honorable Prime Minister has launched that center in 2022. So the things are more clear, what to do and what to achieve in traditional medicine system. In Ministry of Ayush, Rashtriya Ayurveda Vidyapeeth is the nodal agency for accreditation through a board, ATAB, Ayurveda Training and Accreditation Board. This board accreditates the courses which are not under the purview of our statutory body, which is NCISM, National Commission for Indian System of Medicine, the courses which are not governed by that statutory body are covered into ATAB. So there are mushrooming of the courses across the world, and these courses are not being regulated or not been certified with any of the accreditation body. So there was a need to create such kind of accreditation body, and Ministry of Ayush launched it in December 2019. And we created a standard of ATAB. First edition standard was launched in 2021. And this particular standard focuses on how the courses should be and what are the few things which we need to cover to get accreditation in, and also to impart quality systems in Ayurveda education. So, for example, few of the courses like holistic well-being courses, Panchkarma technician courses, there are few courses related to Shar Sutra. There are a number of courses which are being listed in ATAB. And it's my privilege to acknowledge this, that about 168 of the courses in the past 3 years got accreditation. In that 168, we have 14 international courses as well. The first accreditation was given to European Ayurveda Academy. They're running few courses. And the next one was given to, there was some institution in Argentina. And few are in the pipeline. In Latin America, few courses are running. Sri Lanka, few courses are running. In Australia, few courses are running. So the intent of ministry for releasing this standard is to cover these areas in which we were lacking in education system. And we are also giving the capacity building to our sector by creating creating a register also, that how many students have enrolled in these courses, how many have successfully done the courses from these institutions. So we have that, ATAB has maintained that register as well. And there is one other scheme also included in this gazette, which is endorsement of the professional, those who have started in India, but they are practicing abroad. There are many doctors who are practicing in abroad. That is related to Ayurveda education system as well. They are running few courses in their countries. So we are just making the register of it. We are just acknowledging how many persons are registered in those courses. Now let me speak little about ATAB, that we work as per international guidelines. This standard is also has compliance with ISO. So it is having 10 chapters. First 5 are related to the organization quality improvement, and the next 5 are related to the participants or the students, that what is the need and why they are studying these type of courses. And we work like there is a level of accreditation. Level 1, the people used to enroll, the institute has to enroll in that particular course. ATAB declares it for 1 year. But if somebody is clear about their scopes, they can move on to the next level. These are basically 3 levels. Then the second level is just a listing. After that, they are writing their documents on that, policy making and other things. And the third level is for the granting the accreditation. Accreditation is for the 3 years. So, and few of the things which are, few templates and few documentation, what are the checklist and all those things we kept on our website also, that is freely downloadable. And after 5 years, 2026, this time we will be updating our standard. The second edition we will be launching it. And of course, as Joy sir just told that about Ayushman scheme, the persons who will enroll in Ayushman scheme are applicable to ATAB as well. And if they want to enhance their quality culture and the safety issues and reliable, and they want to contribute more towards quality of the Ayurveda education, they can enroll under ATAB. And thank you very much, Dr. B.K. And I will not take much time in this. I have to go in another meeting as well. Thank you very much, and I must congratulate PQI. And
thank you, Vandana. Thank you very much for giving us overview of about RAV and a tab and mark scheme. So thank you very much for joining. Moving on to the next speaker, Dr. Guru, briefly talking about role of accreditation in patient safety.
As all of us know, we're gathered here this afternoon, that the quintessence of any healthcare service or healthcare facility, is accreditation. And accreditation particularly that highlights, patient safety, which in fact encompasses a very broad platform, which has several verticals. just to summarize, a few of these verticals which are essentially important are, one is setting and enforcing, basically evidence-based standards. So what does it relate to? In a nutshell, establishing, clinical guidelines, particularly clinical guidelines for practice of best infection control practices, antibiotic stewardship program, and then, defining protocols for high-risk procedures, and also, most importantly, medication management, which drives and secures, patient safety. The risk mitigation, continuous risk mitigation should be an essential tool in any hospital or healthcare service providers. It requires, the purpose of risk mitigation is to continuously identify the vulnerabilities in an institution, the vulnerabilities of a setup program, and try to address them and correct them. So this is not a one-time deal in a year or 6 months, but as I said, this requires continuous process improvement in any organization. Number two, how do we come across to establish, standard operating procedures which defines the workflow processes in institution, which is one of a very significant element of patient safeguard and patient safety at all times, irrespective of where we are practicing. So this entails, a consistency in our processes. This is not something that you have a written standard operating procedure and then, somebody at the will and fancy, whether it is a doctor, whether it is a nurse or nurse leader or an operation person, cannot be tweaking, cannot be changing, and according to the individual self or need that you are establishing new processes. These processes should be ironclad, and once a particular committee or institution agrees, they should be enforced and they should be evaluated with regards to the outcomes, and then trying to confine with national accreditation bodies as to how they have defined these processes and go from there. Documentation is extremely important, particularly in the Indian subcontinent. Now, we were one of the first hospitals in the country to completely digitize the services from day one, from 2013, with a solid implementation of the electronic health record and electronic medical record system. From that day till today, in the last 12 to 13 years, we have seen significant value of electronic documentation that makes it easy, not only from the standpoint of consultant to consultant, but across all aspects and verticals of the institution, whether it's operations, insurance, billing, accounts receivable, critical care management, so many of these things, patients' records being archived for easy navigation upon revisits and follow-ups and whatnot. And this also enforces a clear accountability. Now, fostering a culture of safety in an institution is very important. And I briefly highlighted in the opening session that particularly when you're focusing on, medical travel to these patients, a culture of humility, culture that encompasses the various aspects of visiting international patients is very important to safeguard the safety. On this front, there should be a clear, in the culture of safety, a reporting system. There should not be hidden agenda. Transparency is extremely important. Simply filling incident forms and being subject to whim and fancy of the operational leaders is not something where we can really ensure a safety mechanisms in a hospital. The reporting system has to be robust, evaluation has to be robust, and action plan has to be robust. Then only an institution can really kind of safeguard the patients. And there should be a system of open communication, whether it is an individual, whether it's a multidisciplinary team, and irrespective of which segment of the institution, direct patient care, indirect patient care, unless and until from the top leadership in the organization engages in open communication, that institution only will be able to provide, absolutely safety protocols. Last but one, how do you ensure a continuous quality engagement in the hospital? That is most importantly engaging continuous quality improvement processes, including QAI and other accreditation bodies nationally They are very particular about these processes where they define in each specialty, identify 1, 2, 3, or 4, quality parameters, which is a steady case, do a certain period of time, have the inferences, and see how that fits into, further improvement of your processes and ensures continual improvement of patient safety. There should be a mechanism of external peer review. This is a big problem in our country. Okay, we always think that fear of losing a doctor, egos of physicians and whatnot. We never seek out that whether something is done right or wrong or all of those things. External peer review should be mandated in any institution. And if this culture is uniformly practiced across India, we will be one of the safest hospitals or safest healthcare systems, and we can proudly represent on an international platform. I am very particular about this. I know that in certain segments of radiology and lab, where this is mandated by accreditation bodies, but this should be mandated across, surgeries, high-risk surgeries, best of infection control practices, all of these significant elements that constitute a safety umbrella or a safety net in an institution should have external peer review. And last but not the least, I think I would, accountability, as already mentioned, because this accountability is not only for your patients or your stakeholders or the hospital board, but we have an accountability to our communities, to our regions, to our state, and the country at large. So transparency in disclosing, what is to be disclosed, mandated disclosure, yes, that happens, but non-mandated disclosure should come out in this country with very defined processes. And in conclusion, I'd like to say, I'm very sorry to say that when we have all these accreditations, but India does not have a defined benchmark in very critical quality parameters. If I need to ask what is the mortality rate of a tertiary care institution and what should be, what should be the best of surgical site infection rate and whatnot. So we are still relying upon CDC guidelines, other international parameters, or you do a Google search, here and there, certain hospitals, or some, scattered information of somebody wrote an article once upon a time, and we're relying upon that. So institutions like UAI should take this and make this as one of the top priorities. Can we really have an acceptable benchmarks in our country on 3 or 4 significant parameters, which should be the drivers, just like your ISO 9000, ISO, all these credible organizations. I think in healthcare needs these parameters for us to compare apples to apples and oranges to oranges. Okay. Thank you very much. Appreciate for this opportunity. Dr. Rana, I think you're truly a pioneer and a visionary. We wish you all the best and all our support is forward. Thank you.
Thank you, Dr. Guru. Thank you very much for your words of wisdom. And I think this is a topic we can keep talking for days, and we'll find some other moments for discussing that length. And for the house, I would like to say that the Continental Hospital under the leadership of Dr. Guru is the first hospital got certified by QI for WHO patient safety friendly hospital standards. So congratulations, Dr. Guru, for that pioneering work, and others are looking for. So thank you. Moving on to the next speaker, I'm really very proud and privileged to welcome Dr. Tina Janaima, who is from Sydney at the moment. She is Group CEO of ACPAL and QAP group of companies, the largest accreditation providers in Australia. She also sits on the board of ISQA, also vice chair of ISQA Accreditation Council, a long-standing healthcare professional driving policy change in Australia and globally. We are really privileged to have you. I know you were traveling and it is a late evening in Australia, but nonetheless, thank you so much, Tina, for accepting, and over to you. The floor is all yours. Thank you.
Thank you very much, Dr. V.K. Rana, for the invitation. And I'd also like to acknowledge and pay my respect to all of the experts and distinguished guests that are on this afternoon's program. Is it okay if I share my screen? And
yes, please.
Okay. You can see my slides okay?
Yes, they are clear up. Thank you.
Fantastic. Thank you again for the opportunity. So just to start off by sharing with you that in Australia in the past 10, 15 years, there's been a real shift in the way in which we view primary healthcare and looking to see how we can shift it to a high-performing multidisciplinary care and a well-being model, and looking at really health promotion, prevention, and ensuring safe quality care is provided across all of primary healthcare. And this has had a lot of policy levers attached to it, in that accreditation has become a prerequisite for payment models within our general practice and our primary care models. AgPal, it has been operating for over 25 years, about 27 years, accrediting general practices in Australia. We accredit over 80% of all of the practices in Australia, and it's approximately 1,500 practices per year are accredited through AgPal. And the RACGP, who's our Royal College of General Practitioners, defines general practice as practices that provide comprehensive, person-centred, continuous care. In Australia, general practice is very prominent. It has a lot of episodes of care. Over almost 200 million services are provided annually, and 90% of all Australians visit their GP. So a very important part of our healthcare system. And the RACGP standards for general practice were introduced in 1997 in Australia, and AgPal was there from the very beginning to accredit, and has evolved over these years with various standards and iterations, and every 5 years they're developed. We're up to 5th edition of the standards and almost about to launch the 6th edition. The purpose of these standards is to protect patients from harm, to improve the quality and safety of general practice, and to provide practices a way of identifying and addressing any gaps that they have in their quality systems and processes. It really fits into the broader quality management framework that general practices, primary healthcare services have. And at every point, whether it's the quality control, quality assurance, quality improvement, or planning, within that whole cycle, every element of the indicators of the general practice standards are incorporated. It's a cyclic model in Australia. It's every 3 years that our practices have to undergo accreditation. It is a voluntary market. It's not mandatory. They don't have to do it. But the Australian government has very cleverly linked practice incentive payments for quality improvement activities that form the practice incentive program connected to general practice accreditation. So if you're accredited, even though it's not mandatory, you are incentivized monetary-wise to be able to get some payments for your practice for quality improvement initiatives. Some of those quality improvement initiatives are, it's called the PIP payment, encourages data improvement in care. So to qualify, general practices must submit data on 10 nationally agreed health measures, including chronic disease management and prevention efforts. And so they get a payment for those measures that they submit as outcome measures, as well as Workforce Incentive Program, which is our WIP program. This supports sustainable workforce in supply and access, especially in our rural, remote regions. It provides financial incentives to practices that employ and retain nurses, nurses being a really important part of the primary care health system, also Aboriginal and Torres Strait Islander health workers and any other health professionals. And it also supports GPs in regional, rural and remote regions. So both of these incentives have been really crucial to the adoption of primary care accreditation, with more than 85% of all practices being accredited in Australia. So really aims to strengthen the primary care performance, equity and sustainability models. There are 3 core modules within the standards. So there's the core, there's a quality improvement module, and there's a general practice module, and every primary care practice needs to complete these. Goes a little bit into the core module. So each of these standards have indicators and outcome-based measures that are related to quality improvement that the practices have to meet. These are the quality improvement activities, initiatives related to a number of indicators. Over 20 indicators are looked at, 10 of which you can submit to obtain incentives for your contribution towards quality improvement. There's a patient feedback component as well, and a number of outcome-based measures. And going back to Dr. Guru's points on benchmarking, that becomes really important within the health system. So we are able to benchmark on these quality improvement indicators nationally across every practice in Australia. This is the general practice module, looking at access to care, the comprehensiveness of care, the qualification of the clinical team, looking at reducing the risk of infection, the medical practice, and vaccine potencies. Some of the drivers for accreditation as a driver for patient safety, culture, and organisation motivation, it really helps clarify the roles, improves the flow of information, integrates services to enhance their organisational structures. Accreditation also fosters a collective culture focused on patient safety and quality improvement. And with over 80% adopting accreditation in Australia, we're seeing a real shift in the culture towards quality and safety. Accreditation also inspires competitiveness and high performance, leading to recognition and a positive reputation for practices. And when accreditation is used as a continuous quality improvement tool, it really boosts intrinsic motivation towards quality and safety. When practices are accredited, it helps boost the confidence of consumers, reduces the business risk, lots of other industry benchmark that provides confidence to stakeholders as well, and enhances this overall service. Just some key learnings that we've had over the past 25 years. Standards should cater not only for those that are exceptionally motivated to partake in accreditation, but also offer avenues for all practices to try and improve on that continuum. Also incorporate health outcome measures. Mid-cycle quality assurance activities also provide practices a rewarding way to exceed just the basic standards and allow them to improve cycle after cycle. Being able to differentiate practice achievement against more expansive standards could provide a competitive advantage in patient care and staff recruitment. Also streamlining indicators and avoiding very prescriptive indicators also encourages practices to integrate documentation into meaningful quality systems rather than compliance standards. And the general practice accreditation model should be a peer review process, which was mentioned earlier. And this really supports a culture for continuous improvement, safeguarding confidential information within that mutually interested parties, and really supports the quality agenda. The evolution of general practice accreditation in Australia, I have published in the World Health Organization Health Brief if you're interested to read more about it. Thank you very much for the opportunity. And congratulations, Dr. B.K. Rana, for the launch of your new program. Well done.
Thanks, Tina.
Leadership globally as well. Thank you.
Thank you, Tina. Thank you so much for a very comprehensive overview of too much of content, summarizing in a couple of slides and in just 5 minutes. Is a tremendous work. Congratulations and thank you for that job. And I think it's many of your points gel with what Dr. Guru mentioned, benchmarking, indicator, performance measurement, peer review process. So I think we need to learn a lot from your experience, and will come forward in time to come that how we can really collaborate and learn from your experiences with a lot of experience backed by data. Because I keep saying Dr. Rana is best in the world, but few people might believe, including Tina, but many may not. But when many other people say Dr. Rana is best, then people will start believing it. So it's always a peer review process. When others saying that you are best, so people started recognizing and trusting those data and outcomes. So I think thank you so much, Tina, for your busy schedule. You took time out and I really enjoyed your talk. Thank you so much.
Thank you. Thank
Have a good evening to you. Moving on to the next speaker, a very eminent speaker, Dr. Kshitij Murdia, comes from, he's the CEO of Indra IVF Hospital Limited, the largest IVF provider in India, and I can say the largest accredited provider in the world. I can say QI have accredited more than 50 centers across India and outside. So they are the leaders in IVF, and he is going to talk about his perspective on IVF and accreditation relevance to that. Over to you, Kshitij. Thank you.
Thank you, Dr. V.K. Rana, and congratulations for this medical value tourism program launch. And all the dignitaries in the webinar. I think it's a proud moment, and we started our journey, I think 6-7 years back with Dr. V.K. Rana. We've come a long way. I mean, earlier there was no accreditation sort program in the entire IVF group, and maybe IVF category as a whole in India. And I think, can I also share my screen? I'll just have a small
Sure,
presentation
Kshitij.
to say, because when we started the journey, this was more like, is it something to be pasted on a wall? Is it a badge that gives you some sort of certification, some sort of marketing, some sort of comfort to the patient? So, and then over the years, last 5-6 years, well, we have traveled the journey with the QAI Institute. I think we've realized it's not just the badge; it's beyond the badge, and it becomes a patient outcome engine and not just a marketing tool overall. Because most of the people, when they think about accreditation, and a lot of inquiries came to Dr. B.K. Rana from other IVF players after Indra started this accreditation program. And then we were discussing how people started 1 or 2 centers and then stopped in between, because the common view is more of a certificate for the website, for reception walls, as something trust signal that you can send to the patients, to the referring doctors. It's kind of a one-time audit, one-time exam that you will just pass, and then you fly away. But actually, it's a whole ecosystem, whole management system, putting the right processes, standards behind monitoring every outcome that you achieve at your center, whether it's any specialty, whether it's IVF or other specialties. How do you measure outcomes? And it's a continuous compliance culture that you develop in the organization. And believe me, it's a big task. When we started the journey, we were already 100 centers plus, already 2,000 people in the organization, who had to, over a period of a few months, had to change the overall working pattern in terms of what data you record, how you work, how you do. So it's a big cultural shift. But I'm very happy and proud today to say that yes, we are at one of the best standards possible, and continuously keep improving our outcomes according to that. And this is something, discipline that makes quality very visible. And you might not, it's not a marketing tool. I would say you not want to project it, but ultimately it becomes a marketing tool, because the outcomes speak for itself. Your complication rates with the patients goes down. Your entire staff works in a very well defined process. So across all the chapters, or across all the standards, or 400 plus measurable points, you start assessing your center everywhere, and hence your outcomes go well, which then becomes a marketing tool, because your outcomes are good, your patient satisfactions are good. Patients would naturally want to come back to you, because all said and done, in healthcare, I believe trust and word of mouth are the biggest patient drivers. And if you can have a system, audit, or a process that can drive both of these consistently and measurably over a period of time across all the doctors, across all the centers that you run, it's a well-defined system. The basic engine is we strongly believe what you measure is the only thing that you can improve. And how do you define the KPIs that are important to you or your patients? How do you measure them every time? what are the international benchmarks where you would want yourself to be compared to, and then how do you act on achieving those benchmarks? How do you do root cause analysis, correction plans, improvement plans, preventive actions? How do you take all these actions to make sure that you hit that, and again repeat that cycle to remeasure consistently every month, publish that data every time. And we track medical data and non-medical data as well across different KPIs. And we strongly believe something that you are not monitoring every month cannot improve. Things that you monitor will only improve. And as I said, our accreditation journey started a few years back. 200 plus hub and spoke centers. We got 48 main labs because we operate in hub and spoke model. The entire procedure happens in these 48 centers, and these are the centers we got QA accredited over the last few years. I think the first one was 2022 or little earlier than that. We've now delivered 1.8 lakh pregnancies across these centers, and idea is to keep improving every now and then. And it's not just about lip servicing or saying something in a context or setting like this, or praising, but the work really shows up in the outcomes also. The journey that we've traveled with QAI and Dr. B.K. Rana especially, now we start comparing ourselves with the US benchmarks on age group wise pregnancy rates that Indra IVF in India can give versus the US benchmarks. And it's a proud moment for us to say that we are comparable to US benchmarks across the 200 centers, across the 350 doctors working with us, and at a sizable number of cycles. We compared our 52,000 IVF cycles versus 165,000 of the US in 1 year, and track the benchmarking, track the pregnancy rate outcomes across different age groups. On an overall basis, we might be nearing US benchmarks, but the age distribution is slightly different. While younger patients come forward for IVF in India, US would have mostly old patients, and that's the proof of the pudding, I would say, because doctors who are working with us could be experienced in terms of few months to few years. And then we see, because of the accreditation, because of the strong SOPs that we follow in a standardized process, I think all the doctors, whether they are 5 months or 1 year or 10 years experience with us, we command a similar success rate across all the 200 plus centers that we have. So I think that's not just a certificate on the wall. It's a number that we keep striving and keep trying to improve every month we go. So I think all thanks to all that mindset that Dr. B.K. Rana has brought about with this institute. And it's lovely to see how you keep adding all these new accreditation programs in general to improve the healthcare delivery in India. And as somebody said earlier, I think Indian healthcare should be known in terms of outcomes comparable to US or UK or Europe, anywhere in the world. Thank you. That's my side.
Thank you, Chidit. Thank you so much. Very comprehensive, very crisp information you gave to all of us. And I think that quite encouraging for others as well. The similar area, similar field players should learn from. I think I personally, I believe in collaboration, learning from each other, and sharing, and and moving forward. So as you mentioned, we started the journey with the Indra IVF in 2020. The first center of Udaipur got accredited in 2022. It's 6 years already with 50 plus centers accredited. So thank you, Chidis. Thank you very much for bringing out and putting the value to accreditation, and we'll keep having dialogue on this. So thank you so much for joining this and sharing your views of IIHL, what you're doing. Thank you very, very much. Moving on to the next speaker, Professor Nazira Chaturvedi. We talk about accreditation, we talk about patient safety. So patient safety has no value without patient's presence, patient's perspective or patient's representatives or advocates. So Nadira comes from the vice chair of Patient Safety Foundation India, which is set up 2 years ago. And I'm very happy and privileged to work with her as one of the trustee of the foundation on that. So not taking much time, over to you, Nadira ji. Thank you.
Good afternoon, everybody. Thank you, Dr. Rana, for calling us. Thank you for remembering that there is no healthcare without patients. We'll always be here. Doctors will come and go, patients will always be there. But my compliments to all the earlier speakers and the dignitaries. It's a pleasure to hear and listen to all your wonderful things. I'm amazed at the resonance in all the comments that have been made, and it'll sound like I'm quoting many of you all, but trust me, we had prepared this even before we heard you all. So I'll just begin with what we do, and the theme of accreditation this year is what? Sustainability, trust, innovate, etc. Let's see how that really comes into the picture from a patient's perspective. So as Dr. Rana mentioned, sharing Malakatan, right? We are just 2-3 years old, and as a patient, as Dr. Guru Reddy also said, what is the meaning of patient safety? The diversity of the very people I don't understand. I don't know where to find a hospital. Rajeev Singhal said that, how do I find a facility, right? So as the first thing, how many people know about accreditation, whether it's a badge, whether it's a screen, whether it's your own internal photo or it's an external audit? And how do I really find it? Trust me, I did not even know, although I went umpteen times for my entire family, I had no idea what accreditation in hospitals was. And thanks to all this industry, now we are beginning to learn. As a patient, all I want is quick recovery, safe recovery, empathy, and I want to be heard and believed. I mean, it seems like a fundamental right in all your accreditation, but really do doctors believe? I mean, I had a person in my own family who kept on complaining of dental pain, toothache. Nobody heard him until it was too late to cure him. So we want care coordination, and there are so many places where accreditation has the opportunity in the care continuum to ensure your two keywords, safe care and quality improvements. I think that's what accreditation is about. So whether I'm coming to the hospital for the first time, I'm getting discharged, or you're giving me prescriptions, or you're giving me alternate about surgery versus medicine versus Ayurveda, I have no knowledge. I sign a consent form without understanding because I'm not competent enough to understand. End result, quality compromised, outcomes are not working. So although you have accreditation in place, are these systems really working? Are they really taking care of me as a patient? Something seems to be missing. I'm giving the perspective from the other side of the table. What is missing? Why is the lack of trust? Why is there so much care, harm that is happening? I think to me, it is the patient himself or herself. And this is an honest statement, not just from a blame perspective. When we analyze the degree of harm, that it is twice as much harm happens because we are careless, ignorant, negligent, or confused. So if you include patients as partners, I think that would solve a lot of problems, particularly in India, which is diverse, which is culturally different. The populations are too high. So there's one size does definitely not fit all. As a person, as a family member, I can tell you my problems. I can highlight that something is deteriorating. I can raise concerns. And that's where I feed into the accreditation goal of improving, sustaining quality, rather than not once, but not just for the audit day, but ever and ever. So the patient voice, therefore, becomes an early warning. This is our belief, and this is what our foundation works for. So we're trying to move from compliance, just from documents, to continuous quality improvement. As Tina mentioned, it's not just the patient voice becomes a patient feedback for continuous quality improvement. I think Kshitij also just mentioned that how he has continuously used and evolved. And I think Dr. Rana is the best person who has consolidated this in his version after standards. And this is what we want to create with our insights, with our person. We're not just a skin-packed bundle of bones. We are real people. I can vouch for this in a very short, crisp story. I was having my chemotherapy for the 12th time. It was my last day, but something went wrong and I started to faint. My daughter, who was with me, immediately announced red signals that something is not right with my mother. And the nurse came and gave me a life-saving injection, and I was saved from a catastrophe because there was something contaminated in the IV bag. So engaging the patient, therefore, ensured what accreditation really meant by compliance, right? So you are putting standards, but I'm the one who's enduring them, and therefore I can ensure them much better. And my feedback, my solutions will help everybody. The benefits are to all of us. I can detect early, I can present early, which means you can cure me early. So your records, your metrics are saved. My trust in you improves. The nurses, doctors who devote their time, their satisfaction improves. And there is an overall quality and profitability built into the system. But how do we do it? So what is this missing standard? How do I convert it? And this slide has come after a lot of hard work, a lot of thought process. First of all, I think we need to be, as patients, to be educated about proper health practices. When should I report? When should I ignore? What is the harm? I don't know. Second is, if you're going to educate me, you need to hear me. It was mentioned earlier, continuous communication. Two people mentioned it. Dr. Reddy mentioned it, Tina mentioned. Continuous communication will bridge that gap that the present system does not have it in the entire way. Capturing adverse events for learning. It is not just the transparency. I think the word that Dr. Reddy used was transparency. And the culture coming together of all this is in the behavioral aspect. Today, what accreditation, whatever standards we have read, lacks, it is there from the healthcare providers, SOP, protocol, procedures, but how do I deliver it? Does everybody deliver it the same way? Why do I seek a particular nurse? Why do I go to a doctor who chats with me? Because the behavioral element is missing. And the more we have technology, the more we have digital screens, the lesser input of the human touch. So it's always touch versus tech, but I think this is much more than that. To us, this is what is important as a patient. And we are not talking out of the hat. As a foundation, it is our mission, and we've been practicing it. Thanks to Dr. Rana for helping us throughout, for creating very simple education material and sharing it with two communities, the users, which means families, patients, and people who are not yet sick, as well as the healthcare providers. So, and we're doing it entirely free. We are trying to fill the trust gap, your second thing, right? Your second goal of today, between healthcare providers and the patient community. So while we are giving out awareness material to the healthcare, to the common people, in terms of webinars, safety tips, infographics, audiovisuals, mailers, we have also created sustainable tools for the healthcare providers. As one keyword that Tina mentioned was that all can use it, not the best can use it. So what we are doing in these standards, whether it is engagement standards, etc., is to help people, whether the nurse is coming in, whether she's changing the shift, whether she's going out, the same material for everyone, irrespective. And this is what we're doing. This is just a sample of the education material, which can be easily displayed, which I can follow. I don't follow it very long letters. Nobody reads it. But also the engagement points. How would you listen to me? Simple ways, small questions, nothing negative, nothing rhetoric. Ask whether I understood, whether I used it, and not just whether that you gave it, right? This is why should you engage, where should you engage, and how should you engage. All this is available in our manuals, and this is why hospitals are looking at us and using it easily. And we're not doing it for the sake of it. We are using this to convert it into a continuous quality, higher benchmark, higher. This is barely a year old, year and a half, 2024 it was launched, because a little girl who had a bicycle accident and had ruptured, I think, one of her internal organs, went unnoticed until she lost her life. So if a deteriorating symptom is told by the patient or the family, or even a nurse or another person, I think everybody should have a right for a second opinion and to escalate without our egos crashing. And to gather all this, there was talk about standards, etc. We have also created and consolidated all the learning into a very simple, patient-friendly hospital standard. It has 11 chapters. 3 of them, I think, are on behavioral, 5 are the general operational, and 1 is on infrastructure. A couple of them are infrastructure. So these can be measured, as Dr. Tina said, what you can measure, I think Shatik said, and Dr. Rana believes in that, what can be measured can be improved. This is our offering, this is our belief, and all we ask is somebody listens to us, cares for us, and together, I will take the responsibility for coming to you early. You need to take the care for your, for joining hands. So do not think we are dumb, not stupid. And I'm not talking about AI. I'm not talking about Google, but I'm just talking here as a person, a human being, a sister, a mother, a wife, a patient, and a healthcare, somebody who cares. So thank you for listening. Please add us back in your accreditation. We will partner with you. We will not blame or anything. Thank you.
Thank you, Professor Nadira. Thank you very much, as always. Very crisp, very powerful message. And I think there's need of the hour, not from now, from for ages, that without involving the most important stakeholder in healthcare, which is the patient, it will not get the what we want to achieve. And that's one of the reasons we invited your board on the board to help us in putting the policies as you thought, and it can be helpful to every patient who receives care in any healthcare institution. So thank you very much for your leadership, along with Dr. Soum Mittal, for driving this agenda of patient engagement in policy making for their own safety. So I think thank you so much, Nadira ji, for taking it forward, and we are really proud of the work the foundation is doing. Thank you so much, and we continue working together in time to come. Thank you. Moving on to the next agenda, Professor Bejan Mishra is not able to make it. He is called by a minister, so we will be missing him. He is a very powerful speaker for consumer advocacy. Nonetheless, moving on to the next speaker, Elaine O'Connor. She is the head of program and strategic partnership at International Society for Quality in Healthcare. We call it accrediting the accreditors. She's not able to make it, but she has sent a video, so we will hear on video. Chandni, please play the video. Thank you.
And I am the head of operations with the ISQA External Evaluation Association, or ISQA EEA as we call it for short. The International Society for Quality in Healthcare External Evaluation Association, or ISQA EEA, was established by ISQA, which is the International Society for Quality in Healthcare, in 2018 to deliver its external evaluation services. So ISQA EEA is a sister company to ISQA. ISQA EEA's primary program is the International Accreditation Program, and I'm going to talk to you a little bit about this program today. So the International Accreditation Program was established in 1999, and it provides a unique global accreditation service to health and social care external evaluation organizations like accreditation bodies and standards developing bodies. And since 1999, the IAP has provided these organizations, so organizations who develop sets of health and social care standards and organizations who assess services using these standards, with an independent third-party assessment process, allowing them to validate their existing systems and to improve on what they do and to drive their continuous quality improvement efforts. So through the International Accreditation Program, we essentially accredit the accreditors, and we do this through 4 unique programs. So we assess and accredit sets of health and social care standards. We assess and accredit the training programs that the external evaluation organizations design and deliver to train up the individuals who undertake the assessments of services on their behalf. So in accreditation, we call these individual surveyors, but they're also known as assessors. And even in some other programs, they may be known as inspectors. And we also assess and accredit the external evaluation organizations themselves. So that would include accreditation organizations. And we also assess and accredit quality and patient safety training programs. So these would be quality and patient safety training programs that are designed as continuous professional development programs for health and social care professionals. So we're not talking here about university training programs in quality and patient safety, but it's more CPD programs. So the International Accreditation Program is a standards-based assessment program. And what that means is that for each of these 4 programs, we have a specific set of standards and a unique and specific set of requirements that we assess all of these against. So, for example, we assess sets of health and social care standards against the guidelines and principles for the development of health and social care standards. And this document sets out specific requirements in relation to the development of a set of standards, so how they should be developed, in relation to the rating and assessment methodology for a set of standards, and also specific requirements in relation to the content of a set of standards. So what we would expect to see in a set of standards that are intended to be used in a healthcare setting. As you'll see here, we have different additions, different numbers against each of the additions that we use, and that's because we update the standards which underpin each of these programs on average every 4 to 5 years. So, for example, in 2025, we published the 6th edition of the Guidelines and Principles for the Development of Health and Social Care Standards. And this, as I mentioned, is the document that we use to assess sets of health and social care standards. So the 6th edition contained 3 new principles relating to sustainable care, digital care and artificial intelligence systems for care, and supporting the care workforce. And what this means is that we now have specific requirements within the 6th edition principles relating to these 3 areas. And so organisations who may be submitting a set of standards to ISQA EEA for assessment for the first time in 2026, as well as existing clients who would be submitting a set of standards for reaccreditation, they would now be expected to have specific content within those standards relating to sustainability, the use of digital care and artificial intelligence, AI systems for care, and supporting the care workforce. So in this way, the International Accreditation Programme provides the likes of standards developing bodies and external evaluation organisations, because some of them also develop their own standards. It provides them with a framework for continuously improving their standards. Because we change our requirements every number of years, they too then have to update their standards in line with the new requirements and changes in the next edition of our principles or our standards. So this year, in 2026, we will commence the revision of our organisational standards that we use to assess external evaluation organisations like accreditation organisations, and we're also going to be revising our surveyor training programme standards. So we're hoping to publish the next editions of both of those sets of standards in 2027, all going well. That work should be commencing in the coming months. So through the International Accreditation Programme, we have client organisations and we work with organisations, either standards developing organisations or external evaluation organisations in over 35 different countries and regions around the world, ranging from Argentina to Indonesia, Kazakhstan to India to the United Arab Emirates and everywhere in between. Our client organisations work primarily in the healthcare accreditation sector. Many still work in the area of hospital accreditation, but we also have many client organisations who either develop standards for or who assess other types of services as well, such as primary care or general practitioner, GP services, or others more specialist services like laboratory services, diagnostic imaging services, dental services, or mental health services, among others. So we work with a variety of organisations all around the world. If you're interested in learning more about what we do in ISQA EEA, I would recommend that you visit our website, which is www.ieea.ch. Here you can learn about each of the different programs that I have mentioned, including the eligibility requirements for each program. It's all set out on our website. You can also access the standards documents, such as the 6th edition principles that I mentioned there. They're all available for download from our website. You can you'll find them on the resources section, and you'll also find other useful resources relating to accreditation there as well. If you have any specific questions, or when you visit our website, if you have any specific questions, you can either contact us there is a contact us page on our website, or by emailing support@ieea.ch. We'd be happy to address any questions that you might have. We welcome any questions from you. And for anybody who might find themselves in Europe later this summer, ISQA, our sister company, hosts one of the world's leading conferences in quality and patient safety, and it will be hosting its 42nd International Conference in Dublin, Ireland in September of this year. and you can learn more about this on the ISQA website, which is www.isqa.org. So I'd like to thank you for your attention. Thank you. Bye now.
We thank Elaine for sending her video for that, just to inform everyone around what ISQA is doing. So thank you, everyone. Now we are coming to one of the most exciting part of this event to celebrate World Accreditation Day is to announce the awards which we have launched for some posters, videos, and so there were so many entries we received, and we have selected some of them. They were all very fantastic, but as you know, we need to select few for some awards, but nonetheless, everyone deserves commendations for their preparations and submissions. So thank you. I now request my colleague Chandni to please play the video for the awards announcements. Thank you.
Every patient deserves safe and quality care. At our hospital, patient safety is our highest priority.
Doctor, he has weakness, fever, not eating properly.
In an accredited hospital, quality care is more than a standard. It is a commitment. This story highlights how patients
I'm sorry. Thank you very much, Chandni. Thank you so much. Thank you, Nadiraji, for reminding I was on mute. So thank you and congratulations to all the winners in different categories. Thank you all and commendations to all the participants and submissions for their hard work. You really put really hard work and innovative ideas on posters and reels and so on. I think this was just to ignite the fire within individuals, to have a sense of quality, patient safety, and putting the standard into perspective rather than just following a book and just not going by what the desire is from the patient and even the staffs and colleagues are. So I think this has been a quite an overwhelming response for us to review all of them and find out who deserves the prize. Everyone deserves the prize, but as a practice, we need to find some. And thereby, we extended some consolation prizes and CEOs special awards because we didn't want to miss recognizing them. So every one of you who submitted their entries, deserves recommendations from us. And congratulations to all the winners. They will be receiving the vouchers which they can encash in time to come. in any of the QAI programs. It's sort of cash, not money, but yes, the cash vouchers which you can redeem in time to come, and just to encourage you all in time to come. So I think we have now come to an end of this event, not to the end of the journey which we have started 8 years ago at QAI, leading the front for quality and safety in country and outside country, as my colleague shows in the front. We are now present in 17 countries, so we are truly becoming global organization. And we want to reach out to those specific countries who do not have their own accreditation programs. And we are very proud to say we have got some international, bids which we won through international competitive bidding process to work with different government organizations, particularly the laboratories in different part of the world. But nothing can be happened without the coordination and collaboration with people like you. We really appreciate your time to join this event, and we really look forward to working with you in time to come. Thank you all, our chief guest, guest of honor, all esteemed dignitaries, speakers, and all the participants who have joined on behalf of the board of QI, on my personal behalf and my team. I thank you all for all your presence here, and we look forward to your continued support in time to come. Thank you very, very much, and have a good day or good evening. Thank you, thank you, thank you. Namaskar.
Thank you, Dr. Rana. Thank you so much. Lovely to be here. Thanks, everybody. Chandni, Samiksha, all of you.
Thank you, sir. Thank you to everybody. Thank you.
I'm sure Chandni must have clicked pictures.